Hi, my name is Dr. Monte Slater. I'm a board-certified OBGYN doctor, and I've been practicing in the Middle Georgia area for 15 years. In addition to OBGYN, I'm also heavily involved in doing aesthetic medicine and also anti-aging medicine, and I'm currently completing my A4M fellowship. Being in an OBGYN practice, one of the things that I have always been aware of is how important aesthetics are to women. And so one of my goals was to begin to learn and to practice the aesthetic side of medicine. So in our practice, we do a lot of non-invasive aesthetic medicine, which include laser peels and laser ablations and treatment for hyperpigmented skin and wrinkles. Also, we're able to do some treatments that include such things as facial fat transfer, and in a lot of those procedures we're able to incorporate the PRP into that process, which will give a significant improvement to the patient's recuperative ability, tone, and helps the procedures to have a longer lifespan in terms of making the person look and feel better. One of the wonderful things about doing fat transfer is the fat that we have can be utilized in so many different ways. For breast augmentation, we can use them for gluteal augmentation and for facial fat transfer, and we're getting very good results by doing those. The most important advancement in liposuction was brought about by Jeffrey Klein, who invented tumescent anesthesia, which has really dramatically changed how we can do liposuction now. It's a much safer procedure now. It does not require general anesthesia anymore. You can use a multitude of different size cannulas for very small areas and large areas. It's just brought it more into the realm of everyday people as opposed to just people who could afford something like that. One of the main reasons for my involvement in A4M was my interest in the bioidentical hormone replacement therapies. As an OBGYN doctor, that is something that I see every day in women who are critically low on all of their hormones, and for many years now we have not had an answer as to how to treat them. And so through good science, good research, and good protocols, we have now been able to bring back hormone replacement for women, to be able to bring them back to a more youthful time in their life, and gives them a much more productive and a better quality of life. And that has really been one of the great things about this training program. And by putting somebody into a nice hormonal balance, you're able to decrease many risks in their lives for heart disease, for diabetes, for mental illness, dementias, and Alzheimer's as we go along later in life. One of the really wonderful things about this is that these techniques and approaches help the person in their overall life, so that the treatment that you may be giving them works well beyond that particular symptom that you might be treating at that time. We now know that diabetes is becoming a huge, huge problem in America. And it's not only just the diabetes, but what people don't realize is the insulin resistance that leads to diabetes from an early time on starts to cause problems for people in the long run. One of those issues is the weight gain. 66% of Americans are overweight now and trending towards obesity. So one of the great things about functional medicine is that we, again, tend not to just look at the issue of obesity as just taking in too many calories, but we realize that there is a lot of hormone issues involved in it. There's a lot of diabetes issues and insulin resistance, which makes it very difficult for people to lose weight when, again, they are hormonally balanced, when their nutrition is appropriate, when the diet is appropriate. It allows for people to reduce their weight and to reduce their risk for diabetes. If you'd like to know more information about what it is that we can offer, you can go to our website, or feel free to give us a call at 478-225-2379.